Hi, my name is Ribat. My dad's name is Shahadat. He was admitted to Aster Hospital since the beginning of June.
Mr. Shahadat Hussain Chowdhury presented with complaints of fever since 2 days associated with difficulty in breathing and mild cough.
His condition is called Acute Respiratory Distress Syndrome, or ARDS in short.
On the first evaluation, one of my colleagues, Dr. Sandeep Pargi, who is a pulmonologist, had seen him, and we had diagnosed a case of interstitial lung disease. Within 2 days of admission, in the ward, the patient developed a respiratory condition which had deteriorated already and was more acute. And for that, he was shifted urgently to critical care department for further evaluation and management. On evaluation, we found that patient had severe respiratory distress and very low oxygen percentage. We started the patient on NIV, which is a type of ventilation where connect the oxygen mask on the face and give the oxygen through a ventilator, which is a mechanical support for the patient. Even after 12 hours, his condition did not improve, and patient was intubated and started on high oxygen support and high pressure, also called as high PEEP ventilation. By now, the patient has gone into a very rare but dreadful syndrome called ARDS, also called as Acute Respiratory Distress Syndrome.
I was outside Dubai. I live in Canada. So when I heard about it, Dr. Sandeep called me. He recommended that I come here immediately. I came here, and Dr. Alai and Dr. Sandeep and the rest of the ICU team have been extremely helpful. He was in the ICU for all the time. He was medically sedated so that he can take in the tube which is inside his throat. And so after 11 days in the ICU, they were able to pull out the tube, and my dad was gradually weaned off the ventilator.
One of the known complications of ARDS and its therapy is critical illness, muscle weakness and nerve involvement called polyneuromyopathy. And for that, patient was evaluated further with an ENMG and found to have what is called as the lower motor neuron disease, which is very similar to aplastic paralysis. Hence, oxygen therapy as a main baseline on a regular basis was provided. In case of Mr. Shahadat Hussain, we kind of pulled out a miracle by not having him to go through something like called tracheostomy, putting something in the neck like opening, and we had been able to take him out of that acute condition, and he's doing well as of now.
Throughout my dad's time in the ICU team and the doctors, Dr. Alai, Dr. Sandeep, and all the supporting doctors were extremely helpful and did a very good job of communicating my dad's condition to all the family members. And day in and day out, I was going to get married in Canada, and my parents were supposed to fly out to Canada to be a part of this celebration. However, due to dad's critical illness and the current situation that he is in, the doctors have advised him not to fly. So my fiance and I, along with her family and my family, we all met at the conference room in the hospital and had a religious ceremony of the wedding here at Aster while my parents were in front of us, which was an extremely important thing for us and a really good gesture from Aster.
Now patient is on the path to recovery, but it will need more time to say from few weeks to months, but they do recover in due course of time with physiotherapy.
So overall, we as a family are extremely happy with the service and the support and the encouragement that the people at Aster has given us, and we've really established a relationship with the doctors here beyond just their role as being physicians. We think they're friends, and we'll always remember them as being part of our family.